So firstly, terima kasih kepada organizer, terima kasih kepada KKM, thank you to TopGlove. Sebab nak kena kita tak payah dulu. Terima kasih. You are clear again. Saya kena and then kepada semua, kepada kami, ambil time today this afternoon to meet me, share knowledge. And then kepada beberapa yang belum important, kepada TopGlove yang belum banyak sponsor tadi lah, kepada expo untuk warga emas, itu important. Yang penting macam ni, I always say to myself, kita jaga hati, must look after your heart, must always tell yourself, happiness is power. And if you have power, you must enjoy what you do. Saya dalam dementia ni memang my life mission, Dr. Aziz. I really want to make dementia super sexy. Semua daripada dementia, semua kami akan menjadi pakar doktor, pakar jururawat, pakar life, pakar IT, pakar President Association yang involved with dementia. Making dementia sexy means your children and your children's students want to be an advocate. You become a dementia care expert. Number one is about awareness. Number two is about stigma reduction. So dementia bukan orang tua sahaja. Dementia means it affects the community, the economy. Saya mulakan dengan soalan. Siapa yang nak volunteer? Who wants to volunteer? Yes. I would like to advise you for you to become a dementia overseas or locally. You must always put your hand first. If not, your voice would not be heard. In kucing, I kata pharmacist orang ni, kenapa suara lemah lembut, lemah gemai? You must say, Faisal, I want to know, I want to learn. If I do not know, get someone who can be able to educate. Next, first question, smile. How many types of dementia do we know? Okay. Smile.
Right. I know the main three ones are Alzheimer, vascular dementia, and
very good. Tambah lagi 126. 129. I'll tell you why. What is dementia? Dementia is a collection of masalah, of problem, syndrome. So the most recognized, that the one that we understand, is section, although we use more English than having bahasa Melayu. So what it means is that Alzheimer's is disease. It's quite after a Bavarian oppression with German doctor. So now dia Adolf Alex Alzheimer's many years ago. So that is the commonest and the types of the. And dia tu ada vascular, that means your hypertension, diabetes, frontotemporal type dementia, tu maksudnya the frontotemporal. Then you have body type dementia, dan juga banyak. So I thought kita hari ni, kita maybe in the future when I talk, I can video gambar dia. Ini yang last year di Kuching. Tak, teruskan. I thought we can talk more about not just the introduction about what is dementia. I'm going to jump in and dwell a lot into the pharmacovigilance. Apakah maksud pharmacovigilance? Kita understand, we are aware, we have the understanding. It's not just about awareness, it's about stigma reduction. It's about timely diagnosis. Mendiagnosiskan orang-orang yang touched by dementia as early stage as possible. The next thing is about 3E ni. Apa 3E, Dr. Zana? What is 3E? 3E. Education. Dengar tu. Educate community pagi tadi. Makan lunch happy semoga. Education, maksudnya healthcare professionals dibantu oleh NGO like TopGlove Foundation. Dan makanan tadi yang extra kita dah. Why is important? We must connect the dots. Yang paling penting sebenarnya after that education is navigation. To support the caregivers, that means orang yang menjaga, membantu people with dementia. Then to navigate them, trying to get the best support possible after the end of life. So I'm busy at it, but actually, I started my career in Dublin. So I was in Dublin for a few years. Then I did my training in Manchester, in Birmingham. I felt at one point I must have a teaching degree, so I got a degree in teaching at Warga University. I also felt that in my life I had to be exceptional, so I got a master's degree in health informatics in University College London while I was working. And what makes me happy is the job that I do now. We help older persons to live longer and better. For FMS, family medical specialists, for allied health, for jururawat, for nurses, for volunteers, for TopGlove, your job if you have older persons to live longer and better. Betul tak? Okay. What it means, that could be your mom, your dad, your grandparents, yeah? Atau in the future, or yourself in the future. So when I ask yang muda ni, do you like the idea of becoming old?
I'm going to accept it.
You need to accept that. Good. Nobody wants to become old in this room. The youngest person in this room is Dato' me. So betul tak? Tapi when you speak to Dato' innovation, championing the welfare of the Warga Emas. We want to clone her, but we don't have a clone machine. So I thought I want to into the concept of why I can do what I do. So ini gambar ni rumah I. Rumah I ni macam Bali actually. Ada air terjun, ada waterfall, ada I like to pick birds. So at one point David and I and then we have 600 burung kakak tua di rumah saya. Because that heals me. What heals me? I'm able to focus. I'm able to go to the point that I'm most at my best sanctuary emotion. Then I can go to work with 110% happiness level. So this is a team that is sponsored via Dementia Australia, via NGO. So contohnya, TopGlove boleh bagi $5 juta per year, contohnya lah. Yeah. Give it to Alzheimer Malaysia, channel to Dr. Amin dengan Dr. Zana. They employ 7 nurse practitioners, 7 matrons, 3 OT, pharmacists, to be able to start flying squad. Apakah flying squad? Terbangkan mereka di Kuala Selangor, terbangkan mereka di Petaling Jaya, membantu orang-orang supaya people with dementia can be at home, seated at home until the end of your life with the best possible utmost dignity. Faham tak? Okay. Lepas tu, you must understand that you cannot do this on your own. You must do this by networking. You must come and habis-habis. United front. The most important workforce in hospitals are who? Nurses. Nombor 1. Betul tak? Betul? The most important workforce in hospitals are nurses. Betul tak, mereka? How many times have you attended dementia expert class? Telur ayam tak? Tak boleh telur ayam. Telur ayam. So you need to lie mistake. Not your fault, not my fault. It's just how we motivate our training group. How many times have you attended about medication delivery in dementia? Telur ayam. Tak apa. Kita ubah. There are things for Zoom or Teams can help you connect to understand. Medication can delay the symptomology of dementia. What are they? Behavioral problems. What are they? Anxiety, apathy, agitation, physical agitation, even psychotic symptoms. So I work in the country. Contohnya kata, bolehlah Dr. Fahazal cakap langkah besar kerja dekat town. Tak. I work in country, regional. You know what it means? Fly once a month. Every day got phone call keluar dan masuk pedalaman to the GP, SMS doctor. Faisal, I've got someone with Alzheimer's disease. I'm uncertain to do because this person is at fast stage and 7. Contohnya, I'll spend a bit more. Now, I work in a hospital. Ini dulu ni Dr. Amin pergi hospital lama version. So this hospital is the most expensive hospital in the world. Seriously. Your number one, ini quiz. What is the most expensive hospital in Indonesia? The most expensive building in the world? Burj Dubai yang tinggi tu. Nombor dua, Singapore, Marina Bay Sands. Nombor tiga ni. It does not make the hospital the best because it's most expensive. What makes the best is you and your knowledge, education, understanding. Not just how to speak, to communicate, to talk, understanding that your environment must be environmental, dementia friendly, and then the doctors like Dr. Amin and matron semua ni, kalau pasal ubat-ubatan, the nurse is equipped with the best possible knowledge in their understanding that at any time, 40% people in this building has got dementia. Betul. This is the research done by the UK National and Australian. So I had the survey dekat Australia 2020. So kalau tak tahu, kena buat tau ni. Betul? Kalau tak saya buat. Masalahnya, kita tak ada national drive yet in Malaysia to make sure give more of clone machine to clone Dr. Amin, Dr. Amin number 1, Dr. Amin number 2, macam tu boleh. Maksudnya, you can tell at any time to become the image department how many percentage are above 65 or 60 in Malaysia and how many percentage are screened whether they have dementia or delirium. Now, saya kerja mana? The old hospital, tapi tengah inovasi baru. Hospital ni is become, when you left, it become focus for geriatrics, orthopedic surgery. We're building a place, ini, untuk brain injury, spine injury, to rehabilitation. Now, yang I work not just in metro, dekat tengah city, but I work dekat tepi laut ni. Masalah ada ni, to see me, sometimes 1 year, but it doesn't mean we cannot start therapy now, because we have FMS, GP disorder. This GP, last week ago, I taught GP in regional. The GP is able to diagnose dementia, sometimes with collaboration with geriatrician on the phone or by Zoom or by Teams, to be able to instigate the right medication or pharmacovigilance from the beginning. And then to modulate, to work with the community, like how the HTM, give the best program. Tapi yang penting, I mentioned to the slide this morning, I was so proud, not because we have got this or this, no, Mr. Mahal. It's because the Elizabeth Hospital in Adelaide was voted as the best, most outstanding hospital in Australia this year. You know why? Consumer experience. You know why? The moment they see you, they audit, doktor ni bagus, senyum selalu, Dr. Amin bagus, format senyum selalu. Itu yang kita mahu. Macam sakit ini kata dia fisik, dia tahu ini macam ini, makan ini saja. Ini cara-cara kita rawat supaya mengelakkan infection, kurangkan MRSA. So kalau nak cerita, to understand this, dementia is a tsunami, it's a pandemic. In 2050, there'll be 300%. So I hope at that time, maybe, Dr. Amin, there'll be 10 of you. Amin.
We have 24 generation.
Yeah. Yeah. Tapi for Klang, maybe 10 of you.
Klang by 2026, we will have 5 generation.
Amin. Itu pancit, awal tu kucing, ada pancit ni. Benar, semua nak buat. Itu masalah semua.
Dementia.
Ya, pancit.
You always invest in the best generation in Malaysia.
I know. But what I meant to say is that tak boleh lah. Kita kena make sure that kita whatever we do. I'm going to show you a video. The first video yang mana kuning ni kata what is Alzheimer's disease. Lepas kita lompat slide, lompat boleh? Okay.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination. And in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure.
So, Dinesh, what are your thoughts on watching that?
The progression is slow and also it spreads throughout the whole brain. Slowly, everything they get, it influences them from their daily life.
So, like Rani asked me, how do people die from Alzheimer's disease? It's the effect of the involuntary respiratory. Most of them will choke or have pneumonia, aspiration. Some fall, but importantly, the trajectory of the disease affect not just their nutrition, their muscle mass, and in the end, all the cumulative effect. Now, kalau kita tak cakap pasal types of dementia, banyak. I am very particularly interested in Lewy body type dementia. With my job, I work with public, that means hospital kerajaan, macam contohnya, kerja di Klang, berzana di sini. I work also for NGO, maksudnya Dementia Australia, that means solely doctor for the past 30 years. So what I do, we work, number one is about awareness, stigma, support. One-to-one, we have staff, can be medical, non-medical, majority are nurses or like, and they will work with the person at home. They will make sure that the best possible place for the person is at home. And with my other job, 19 program, that means state funded, NGO funded, we are supporting people towards the end of life with dementia at home. We work strongly with palliative care, make sure we medicate people like a pump, towards that. Because I realize most patients like us, and they would like to be at home as long as physically possible. Tapi the masalah tu is the support education. And then I did a talk to the Bangladeshi Australian Association dekat Adelaide. They have this annual meeting. I mentioned with them, the in Quran in Surah Al-Nur is mentioned about it. So that means for Muslims, for others, I think it's important that we know that it's something that is important for knowledge aspect. Now, this next video is 101. This is the video yang I will share with my patient. Contohnya, katakan macam doktor kan. So you won't show the first video to your family or the patient yet. you will introduce them with the concept of how to make sure the video is healing and dignified. So the video next I will show you is by Pipa Snow. Pipa ni? Pipa Snow, dia nama orang tahu lah, Pipa. Pipa Snow. So kalau tak percaya, kita pergi Google, YouTube, bermacam-macam. Contohnya, now, Dinesh boleh tak demonstrasi? Kan? Come here. Boleh punya kursi dah. Bring the chair. Example. So, Uncle, kasih Dinesh, sorry. Ada beberapa perjanjian dengan Dinesh. Duduk dulu. Contohnya Dinesh has got, sorry, you don't have Alzheimer or whatever, kan? Tapi I want to demonstrasi. So, Dinesh, are you able to sit facing Ajina? So, contohnya, klinik, kita kata 1 meter ya, mata, same height. So, doktor, 1 meter. Make sure you are safe. Hospital ward inpatient, diabetes. Takut ini kena buka. Berat. Salam different. Because the pastor will teach you how to shake hand for people that you know who have got dementia. Salam cari kasar. Bagus. Cara tipasnya, cara dementia modulation studies. Macam ni. Kan smart ni Dato' Rana. Smart ni kan. Sharing love. Nampak? Sebab they can feel you. Let's say katakan you have a patient, matron dekat hospital, dekat ward, degil kan, tak mau bangkit, tak mau jalan, tak ada toilet, macam mana ni? In English, a stubborn patient. Do not use the word stubborn patient. Now you're wrong. Resistive lah, tak mau. So what I do, the next me, how are you? Jadi kan, nampak ada wait, glamour kan, ataupun kan glamour. And ni, sorry ya, nak pegang tak? Pegang pakai, macam ni. Pada, can you stand for me please? Glamour, buka tangan, jom jalan. How are you today? Good, good. So remembering that with dementia, they have the tunnel vision. What is tunnel? Can you use benda macam ni? Sini. Kita boleh expect. Benda one eye. Right eye tutup. One left eye buka. Sini. Tutup your left eye. Jalan. Okay. Who can you see sitting next and who is on my right hand side? Jangan pula. Okay. What is the color of the baju yang is worn by the nurse on your left hand side? Baju apa? Yang itu. So imagine with dementia, they got tunnel vision. I had lunch and I sat with Puan Bessie kan. Dia kata mak dia tunnel vision. Maksudnya kat senang kan? Kita dah begitu kan? Thank you ya. Senang push. Kasih. Lepas tu dia masak. Boy, saya kena masak. Contohnya nak mandi. Yang ajak ke saya. What is the pastor? Sorry, I'm not going to ask you to straight. Sorry. They must stop. It's klinik kat rumah. Yang problem. They do not want ADLs. They take provision. Nak mandi kan. Because you know what? Actually, it's not their fault. Temperature of the water is number one. Number two, the water kan, the shower tu. Bila kita ni, sakit. Very painful. Because the threshold for pain has been lowered intensely with dementia. Remember, the brain is dying kan? So what we do, she said, ambil towel. Towel tu, atas dia, shower ni. That is important. Bilik ni is much better than bilik yang tadi because my voice was echoing. So with dementia, you will see, lepas ni kita tengok ni dulu, lepas tu tengok yang video next one ya. Terima kasih. Thank you. Thank you. So, imagine kan, kalau saya cakap dengan Haikal ni, kan, Ijat. Whatever I say to Izzat, we do this. Now, what are the primary colors that you see? Primary colors. We know. Dia tahu kan tadi kan? Colors. Yellow, blue, red. Blue, Yellow, red, kurang red, tambah. Primary colors. With dementia, the brain is reverted to see primary colors, warna-warna utama. Maksudnya, blue campur yellow apa? Green, 4 colors. If you go to validated environmental friendly nursing home, dementia nursing home in the UK, in Australia, you see most of the color that are tailored to that. Okay, maksudnya the person punya brain can see that color better and times the appetites. Contohnya kat rumah, all of the drawer kan, ini drawer benda yellow sticker, socks. Next one, ini nak tukar beri. The plates, mat tu kena merah, biru ataupun yellow lah. And then, kalau orang tu progressive dementia, it got arrows. Kuning, tong. Nak menuju ke arah dia yang apa? Okay, now we'll see the next video. Is keep us know one. Terima kasih.
So the first question is it or is it not dementia? But we actually have a question before that. Normal aging, not normal aging. Because before we start assuming it's dementia, what we need to figure out is this normal for this person or is something changing? And if it's changing, is it necessarily permanent or could it be something that we could fix, we could address, we could modify? A couple of examples to keep in mind would be something like depression, which is treatable, hypothyroid, treatable, medication problems, treatable, even a problem with hearing that nobody's picked up on, or a problem with vision, or a problem with a new medical condition, maybe like diabetes or something. So what you want to notice first is there a change? Is something changing? And don't make assumptions. We want to check things out. People deserve a good workup. We don't want to think, oh yeah, look, it's not normal, it's dementia. We want to think, I don't know that this is normal for this person. Something seems to be changing. And if we notice the change, we want to find out, can we do something? And if we do that and we're still going, something's going on here, we don't want to make the next leap, which is, it's got to be Alzheimer's. It's bound to be Alzheimer's. Not necessarily. This is where there's a lot of misunderstanding about what's dementia and what's Alzheimer's. And what does it mean? It doesn't mean memory problems. When we talk about dementia, we need to be thinking about a great big umbrella term. A great big umbrella, as a matter of fact, that we find underneath that umbrella approximately 85 to 90 different conditions, forms, causes of this thing called dementia. And dementia is not maybe what you think it is. It's more and it's different. Alzheimer's is under there. It's certainly one of the big boxes under there, but it's not the only box. And what we used to think, 80 to 90% of all dementias are Alzheimer's. Now we know they may be mixed pictures, a couple, or a different one entirely. Things like Lewy body or frontal temporal dementias, or maybe vascular dementia, or dementia that comes with a health condition. And we think now that dementia actually isn't a diagnosis. So if somebody has been diagnosed as having dementia, something's not right already because you don't get a diagnosis of dementia. When you have dementia, you have a syndrome, a collection of symptoms. So what do we want to do? Well, we want to know we're under the umbrella. Well, what does it mean to be under the umbrella, to have dementia? Well, it means 4 things, typically. Number 1, at least 2 parts of your brain are dying. They're changing, and we can't fix them right now. So your brain is changing on you. At least 2 parts. One of them will typically be related to memory, but not always in the way we think about. It's not always the can't remember new things, but do remember old things. For alcohol-related dementia, I have blackouts, but they might be a variety of blacked out or missing pieces. For vascular, I again could have a whole bunch of different memory issues. And for frontal temporal, I may think something happened that you don't remember happening. So with memory, it's important to recognize it's not just the standard thing. Now, the second thing that's true about all dementias is that right now, we currently have nothing that's going to fix it, cure it, make it go away, or even stop it in its tracks. So what we have to realize is we're going to have to figure out how to help somebody live. And on average, for all the dementias, if we considered all of them, we'd be talking about 8 to 12 years of symptoms. Now, it could be shorter, it could be longer, but 8 to 12 years is a long time to endure something that the third thing that's true about all dementias is constantly changing. And it's constantly changing because this is a neurodegenerative or a progressive illness. It's not going to stop until it's over. And now we get to the fourth thing that's true about all dementias. They're all terminal. But frankly, so's life. So what we've got to stop thinking is, oh no, and start going, oh, I'm going to have to make some changes. I'm going to have to do something because I am living with someone who's living under the umbrella. Now, let me say that again. When one person gets dementia, it doesn't just affect that one person. Everyone around them is going to be living with dementia one way or the other. So this one person got chosen, but it's not a choice they would have ever made. You choose. And the question is, will you pull together and support that person? Or will you fall apart and walk away? Will you wear yourself out and not make a positive difference? The purpose and the reason I do what I do is to help you do what you do. And that's where we can make the change happen. I can't change the condition. I can't make the changes stop. But what I can do is offer you ways to start changing to better match what they're able to do, to acknowledge what's missing and use what they still have left. There's life under the umbrella for all of us. Life under the umbrella is a challenge when it's in you, but it's also a challenge when you're living with the person who's experiencing it. The choice is yours.
Okay.
With dementia, let's pull together.
Okay, better one. So this is the video that I'll show to the consumer. Tapi imagine kalau you Google, YouTube kan, banyak sangat video. If you can watch this after you watch your Netflix, alhamdulillah, you will be learning a lot. To me, that is the power of knowledge. Okay? So I know you have an hour or less time in clinic, but you can tell the family. So normally I would send them links by email, about 15 to 17 links, so people know how to change clothes, how to stop the repeating conversation. Repeat, penat. Help them to sleep better at night. Help them to makan. So what I'm trying to tell you, if we can do it, let YouTube, yeah? Now, this is important. How can we learn? If I can take my voice recording. How can we learn about science? If I want to create a medication, magic bullet to cure Alzheimer's disease, I know how to do it, but we do not know actually. We knew it because thousands of years ago, during the Neanderthal, orang-orang zaman purba, when they search for their food, they have to hunt and memburu. Memburu maksudnya mengejar berlari-lari anak atau berlari-lari bapa. Contohnya, now kita kena exercise by nature. What's your name? Narita, how many steps do you walk every day? Dr. Ulani walk 20,000 steps. You're not sure. I maybe can't do. Tapi they beat me. I'll tell you the story. One of the causes of dementia is normal pressure hydrocephalus. Mama ini memang terror, ini memang volunteer. Tapi from September to November, he cannot walk. He cannot walk. 2 steps, 3 steps jatuh. And then the our MRI, then luckily there's a new MRI machine arrived in Adelaide, at St. Andrew's Hospital. The latest machine can detect problem with brain ventricle CSF flow. The other one tak nampak. Jumpa Dr. Professor Amal Abu Hamdan, top surgeon in Adelaide. She said 50-50. Masuk tube, korek kepala. Korek. Ada tube, ada bar. Forward. We did do it, can walk every day, 10,000 steps walking. Without treatment, guaranteed dementia, incontinence, jatuh tiap-tiap tahun. One of the causes of dementia.
Can I share?
Boleh, of course.
Can I share the experience in this talk?
Yeah.
We got a patient with similar condition.
Here, yes.
We managed to show to the neurosurgeon that if we do LTV,
Yeah.
we what can some sort of people, there's exchanges between the walking speed. You know, when we talk with new citizens, what they say. That would have a problem.
I'm so sorry.
Very devastated, very devastated.
I can feel what Dr. Amin is feeling. Now, what Dr. Amin was trying to allude is that it's a test called Miller Fixture test. So what we do, we keluar ni, ambil lambda puncture, take brain fluid, take out. Lepas tu, dia ada pre-lambda puncture dengan post. 3 hari berturut-turut. Tapi ada program. Dan by OT ni, dengan physio. Kita buat, yang buat tu, radiologi, kita ada iPhone. Cabut. Then within taking the fluid out, brain fluid, David can walk like he fast, better balance. So Dr. Amin was trying to say, sometimes he believe in that situation that orang tua-tua tak dapat kelebihan untuk perubatan, untuk operation. It's the system problem. It's not. It's how things are. It's not that doctor's problem. It's the situation. It's the how the situasi kan sekarang. Itu yang cik. Now, kalau contohnya dia jalan kan taruh tiap day minta tolong, dia punya protein from the muscles will go pergi kat ni pergi sini. Hippocampus ni the bahasa Greek-nya what does it mean? Hippocampus Greek. Seahorse. Kuda laut. Dalam tu dia ni tahu banyak neuronal activity. Kalau macam saya meloncat, menari, buat zapin, you will never forget me wheelchair. You kata menangis, you will not, because exciting. It makes that highlighted better. You know, kalau orang tu drama, kalau klinik, tiba-tiba ada satu patient jerit, sebenarnya. Saya ingat lagi. Okay? So if I speak loud, that is you will remember me, wouldn't you? If I move more, boleh ingatkan saya kan? What I meant to say is that memories must be interesting. You must be interesting. Pakailah bunga merah ke kuning ke biru lah biru. Lagi biar sikit. Jadi kalau patient boleh nampak, faham tak ni? What I'm trying to say is this. Kalau kita boleh ambil protein from the muscles, kita bayangkan dengan anti-amyloid. Wait, bagus. But between here ada this blood-brain protein barrier. You would allow those things, the magic bullet to go up. And that's why we haven't found a cure for dementia, because everything is blocked up here. So that means kalau kita nak sihat, kita kena exercise. So they have 10,000 steps a day. You have to post whether I post that, I watch that, The next thing is meditasi. What is meditation? Siapa yang boleh relax? Okay, relax. Saya rasa kan, ni relax sekali. Doktor mana tak buat meditasi? Akan dapat. Meditation it's not about aura or spectrum. It's about you do what makes you happy. Some people menyanyi, main gitar, some people main YouTube. Tapi YouTube tu kena gini kan, tak boleh. Some people exercise biadab family, ibu ayah. Some people baca Quran, some people pergi temple. Doesn't matter what you do. But to me, meditation is controlling your respiratory rate. Contohnya, 1, 2, 3, nose. 5 kali. You're trying to tell the brain and the heart to relax. You're trying to control the emotion so that you go back to your own foundation of sanctuary. What is important here? My important time now is to make sure when I go back, I've done my job well. Maksudnya, you're happy lah tengok Dr. Faizal cakap berapa kan? What I'm trying to say is this, if you exercise, your hippocampus will grow by 10%. If you meditate, 20%, 30%. Bagus tak? Okay, now, kita nak lompat lagi. The whole process is this. I learned as well as all of you, we started somewhere. So I started my career, I eventually became a specialist in Birmingham. I work at the center. I like the center because it focuses on equality and diversity. Semua orang sama. Termasuk orang tua, termasuk orang dewasa dan budak-budak. The most important thing is that I work with the most fantastic, phenomenal nurses. Nurses yang kepakaran orang tua, nurses yang kepakaran untuk orang disability, nurses allied health yang paling pandai untuk membantu orang with dementia supaya orang boleh pakai baju mereka sendiri kemudian hari. Yeah. Also, kita kena faham knowledge is power. The more you do open session like this, Zoom ke benda ke, people will start to learn, irrespective the part of Selangor you are. So dulu we always do monthly team. Oh my gosh, before dulu nampak ni, poster board ni, ini muka di England. So you know what is the most favorite topic? Dignity and spirituality. Kita jemput Peter, priest, Buddhism, to talk about how to deal with that situation at the end of your life. Kata orang kena answer, how do you deal with it? It's so important to talk not just about spirituality, mental health, semua pharmacy, medicine management, promotion of respect, promotion of the right medicine for people who have sensory disability. Betul. Years ago, in England tak boleh bawa flower. Flowers are not allowed in the walks. Why? Dia punya pollen tu. Tak boleh. And then animals cannot be brought into the walk. So I realized this. Why did we change the mindset? So kita ada researcher dekat Imperial College London, they released the paper. The only thing inconvenient bawa bunga dekat medical ward, surgical ward is inconvenient to start. That means the state nak potong bunga dalam lebat benar-benar. Kan tak ada masa, kan masa dia kan berbrilian kan. So bunga come back. I felt that it's so important that we bring pet therapy, humor therapy, dance therapy, supaya with all the work that we do, collaboration using robots, AI, we can reduce the length of stay in our acute care center by 4 days. Kalau contohnya di Australia, 1 day in the ward is $2,600 Australian. Kalau surgical ward is $3,600 economics of dementia. If you can do this well as a team in the ward, in clinic, you can be successful in impressing your big bosses. Masalahnya Dr. Amir ini, banyak orang dalam dunia ni yang negatif. Orang yang negatif tak boleh lah, tak lah. Orang ni ada problem with all the solution. Faham tak? Ni, tapi tak boleh. Kita kena ubah. That's why I'm going to spend 9 more minutes. Lepas tu medication sahaja. So in Australia and UK, they have these governance processes, how to do clinic. Ada email dekat Dr. Zana, dia tahu, boleh share dengan Dr. Amin. Macam mana nak start memory and cognition clinic dengan guideline dia. And also in Finland, so I also PhD supervisor untuk nursing degree, mengajar dekat Finland kan, dengan ADU. So I have PhD before, and then they said I want to do a booklet untuk pesakit dementia. The booklet looks like this. Dalam booklet tu ada what is dementia, followed by what are the ways of working when we talk to, when we support with people with dementia and their families. So this is the campaign that myself and David introduced to Australia about 13 years ago, and that is my proudest life achievement. I'll tell you much more towards the end of this. What's important is this timely diagnosis. Making sure that when we meet them, we say, Faisal, you've just seen Dr. Amin. Dr. Amin said that you have vascular type dementia. Faisal, what are the symptoms? Video lah. Faisal, what test? Brain scan, MRI, CT scan. Faisal, how long did it 3 bulan? Ada duit private room, 4K or no? And then medication. Boleh tak driving? Boleh kerja tak ni? Those are the things that you must document, you must write, you must be able to communicate with your patient with that hour. Before that, they will see awareness for an hour dengan telah apa. Link to NGO, Dementia Australia, South Australia. Supporting, navigating. Kan cakap pasal nak support family caregivers ni kan. Ini dokumen kita bagi untuk membantu caregivers di rumah. Patient number 2, number 3, that means you jugalah. Community worker, volunteer people. To be able to, ini penting, advanced care planning. I know when I spoke with the team in healthcare professionals, they are at the beginning of the stage of advanced planning. Apakah advanced care planning? Contohnya, saya masuk hospital, saya sakit, cannot speak, cannot talk. Then my family akan boleh kata Faizal, kata kalau dia cardiac arrest, dia tak nak dah bisik-bisik, dia ada meninggal je aman. Now, the next aspect of this is kalau ada dementia, tak boleh planning. Ini OT ni, ini social work ni, tak boleh planning, event tak boleh. Number 2, tak boleh make choices for medical, nak kena untuk ada stimulasi, untuk choice, untuk lifestyle, support to be given at home or time to go to nursing home. We make it sure compulsory for everyone that comes to hospitals in Australia to have this done. Who needs to witness? Doktor boleh, nurse boleh, polis boleh, orang post office boleh. Tapi involved directly dengan that person. Jadi seorang ini bukan will, ini bukan pasal estate, ini pasal untuk keterangan diri. Itu penting untuk menjaga tak abuse. Yeah. So lastly is about how do we support people to start program rehabilitation. So yang saya passionate ni, people at the end stage of dementia and the running is for terminal agitation. So a lot of referrals come from palliative care. Because when someone at the end of their life with dementia, everything is augmented, everything is enhanced. From the psychosis, agitation, nocturnal disturbance, pain is very complicated. So there must be an expert team to do it. So luckily with NGO, I lead this service team for South Australia, and I'm leading a new team based in New South Wales. Contohnya, kita bercakap pasal ni lah, pasal cure kan? There's no cure. There are medication that can help to reduce the accumulation of this amyloid plaque. Tapi ini in the mula-mula. That means it's on the trial done by Levy, not available in public hospitals or private hospitals, only in research centers. So I thought it's important that for me to jump some of the slides and focus more on medication. I wanted to stress again why we have to shake hands like that. Tengok doktor ya, 6 tahun Alzheimer's disease. Bill Attermoller is a orchid artist, he, and then they discovered when he was diagnosed with Alzheimer's. Tengok kali-kali dia buka. Year 1, 1996 sampai year 2000 sampai tak ada kat mana. Jadi kalau malam-malam semua pakai emas ni, hijau bagus, hijau bagus, emas hitam, tak ada. Tak ada. Setengah pakai emas hitam, biru fail. Biru hitam, biru. Ni dah. Tak ada hitam. Kalau hitam, kalau malam pergi buat, dapat padam. Biru tak. Because maksudnya, with dementia, you lost the main colors. Eventually, even the colors yellow, blue, red, and green, you got no colors. That's why at night you must put the night content. Nampak? Sini. This is the reality. People with Alzheimer's disease, laki-laki male, lifespan 6.7 years, female 7 years. Probably this is people kita nak consider dia punya age lah, frailty index, medication, bagi. Lewy body dementia ni yang saya suka jaga ni, complicated. But they have complex hallucination. They have fluctuating cognitive state. They have Parkinsonism. And these people, 3.3 years. You know how long 3.3 years is? It's so little. Do you know how important this condition is for dementia? I tell you. Tidak ada dementia. The most is dementia. Followed number 2, cardiovascular heart disease. Number 3 is stroke. Number 4, cancer. Masalah ni, the funding for government Malaysia, Australia is not strong on dementia yet. For aging, it's more focused on stroke lah, heart lah. Kenapa? Are we not worthy if we have dementia? We treated better? That's a question. Okay. That's a big question, right? But yet is the phenomena more than COVID. This will stay forever. All of us in this thing will become old if we do that. Okay. Kita punya temporal. The loss of the volume of memory. So I wanted to skip. Sebab I nak fokus on medication kan. Bukan chemical, bukan medication. Kalau orang tu agitated, tapi nak cuba tolong bagi them dose therapy. Dose therapy ni ada heartbeat, they communicate, the patient I speak on Tapi dia boleh rasa ingat rasa marah, faham tak? So contohnya for Dinesh, kalau kita tengok graf ni, this was done by a group of researchers for Commonwealth of Australia many years ago. Ini cumulative stress. Apakah maksudnya? Maksudnya with dementia, the brain becomes more tired at 7 o'clock in the evening. The body becomes more thirsty, more hungry, more sleepy, more confused. And then lepas tu, the peak is at 7 o'clock, 1 o'clock at 7. So dekat Australia, this heaviness and over. Masalahnya orang kalau jaga work for more at this time of it. So you need to cut 1 hour earlier, you bagi Panadol, katakan pukul 6 pagi, ke bagi painkiller. So antipsychotics, Dinesh, you must not give it when the peak has happened. You give it earlier, pukul 5 pagi. So in this case, kata bagi, pukul 7 pagi, the day before. Because if you give it at that time, it's too late already. Rest marido, tak jalan dah. Tak jalan dah, buang duit saja. Betul tak? So I'm going to talk a lot more about this. So this is important. Kalau dekat sana, saya kerja sekarang, semua kita berkumpul and ask me, Faizal, I want to refer someone with this type of dementia. Namanya patient Faizal. Patient ni ada stability of dementia. I tanya banyak orang-orang, how do you grade stability of dementia? Aku jawab nanti.
Depending on the function of the patient, function is the earliest state for the grade.
Severity. You're right.
That was one of the stages.
Yeah.
The grade is by doing 3 minutes, and you can put it.
Okay. So betul. Dia in Australia we use this. So I mean, dia guna ni. Fast scale done by Rasberg and T1988. This is very important. Let's say someone with Alzheimer's disease, you met dia buat cognitive screening, MMSE ke, Monash, KDS, benda lah. Dia check ibu NP, menghidap semua lah yang buat ada OT. Next thing before the meeting, MDT group tu kata, patient Faizal ni, I think got Alzheimer's. But PET scan menunjukkan. Clinical assessment talk to the family menunjukkan dia masih boleh membuat benda yang banyak tapi struggle nak bayar bill online. Struggle lah nak buat masak untuk lunch party kawan-kawan. Tak boleh travel so. That means it's past scale 4. What does 4 means? That means mild dementia. 3 years from now, that patient come and say, Dr. Amin, dia kata, the wife kata, patient ni tak boleh pilih baju. Kalau tak tolong, tak baju, still he has the same clothes. Yeah? Maksudnya, the brain start to lose more than 40% of the hippocampus, affecting the parietal and frontal lobe. Kita buat video kan? Moderate stage. 6 is 1 person to help someone to help them to dress, to toilet. 7, lifespan is most likely less than 4 months. Imagine in Australia, I would say 50% of those age 80 and above are likely at number 3 to number 7. Yeah. 3 is MCI. A lot of the work of Amin now is to go at number 3 to reverse the effect of plaques and tangles in the brain. Tapi kita yang berempat benda balik ke mana ni? What it means is that the medication now will be depending on those. The next important step is this. How to modulate your antipsychotic, your benzodiazepines. Yeah? It's not enough to mention about the type and then the associated symptoms. It's not enough to mention about the severity. In Australia, the MMSC itu dia buat study saja. Lepas tu ada yang mati lah. Tak kisah. Sebab dapat duit, funding, you must get MMSC, dapat duit. Supaya ubatnya ditanggungi kerajaan. Sebab it changes every hour. But how can you expect? Dulu, before 2050, if you don't demonstrate 2 points improvement, you're not going to get money. It just doesn't make sense to me. Betul tak? Sebab you know you cannot grow brain cells. What? Betul tak? How come they accept people who develop better? The drug is not going to be what it does. It reduces the emergence of the problems associated with dementia. What are they? Number 2, dementia, past scale 4, no problems. Number 3, nighttime disturbance, wandering behavior, apathy, depressive mood, repetitive questioning, shadow, ikut je. Tak ada risau tu. Number 4, you can see depression, verbal aggression, psychosis. Up to number 5, severe lagi. Number 6, physical agitation. So, and psychotic depression classes for isolation. Psychosis, agitation kan, barulah. Ketika Dr. Amin kata dekat Dina, Dr. Amin, ada customer dengan Faizal ni, Alzheimer, fast 5, tapi number 5 ni. Macam mana ni? Depression pun dah depression. Ha? Kalau psychosis lagi dah ubat, psychotic, pilih dia jangan. Lepas tu kalau dah baik, turun. Today, jumpa this week, number 5, 2 months of dia memang bubur punya, ini bukan jual semak. Dia bagi ubat ruangan ke tak? Do it. It's how I speak on it tadi. It's no. Maksudnya, I want you to understand there is ways of doing it. Ubat tu dia membunuh. Ubat ni bukan dibuat yang safe, kan? Nanti I talk a little bit more later. So, ini adalah cara risiko di Australia dan di England, how to look after old person generation, termasuk orang dementia. 1, 2, 3. Nombor 1, zero tolerance to all forms of your job, reduction of chemical abuse. Okay. My job semua termasuk nak make sure my patient is not lonely or isolated. Tak boleh 25 options boleh buat kan? Lompat ni tak payah. Services available. So katakan contohnya you are working for kami dengan Alzheimer Malaysia, you want them close working with you in Klang. You kata, can you please get funding from TopGlove? Satu nurse practitioner, pinjam satu nurse coordinator, pinjam, ajak betul-betul. Awareness, post diagnostic, sama lagi nurse, OT tu nak. Macam mana nak sebab? Okay. Lima pula, memilih kan, sosial. Pinjam sana, yes, boleh. Non-profit NGO, PO ni.
Is it equivalent to the DFM issue?
Yes. Tapi power lagi for Australia. Who's the only doctor that work for them? I did for the past 7 years. I did the whole state service application. Yeah. This is the money from TopGlove. The money from petrol nak masuk. Bukan yang money daripada kerajaan negeri. Bukan. Orang bankrupt. Betul tak? So I'm telling you, you have to take TopGlove. TopGlove is like a CCO. I tak tolong pun bagi bos korang. Okay, now this is important briefly ya. So dekat Australia, I lead a service ada common program. Contohnya Dr. Amin dengan hospital, doctors, nurses, selatan. Contohnya orang masuk di Australia, kita masuk ke hospital kita, every year ada national audit. Apakah maksud tu? Number 1, mandatory training tu. Tak boleh pass. Jerawat ke, everything. Number 2, di sini 50 ada orang asli. 65 orang Australian. Kita akan guna screen. We started the research in 4 hospitals in the whole Australia. We screen everybody. Kalau positif tu, kita guna ni tak? Kita guna ni, kita guna 480. Maksudnya, kalau positif, patient tu katakan skor 4 points and above, AMTS, berapa, ada je salah dia. We are making sure that the symbol goes up to the back. Ini jam, saya ini ke hospital. Yang ada simbol ni, they have dementia. We screen them every day, automatic specialist OT, automatic specialist physio, automatic MMR pharmacist, must communicate. First 24 hours, must get black history already. Yeah, called GP already. What it means is basic saja. Ini cara berkeperimanusiaan. Speak better, speak nicer. This is how we help. This we teach to tukang masak hospital, hotel hospital, semua. Okay. Lompat sekarang. What we've done, we've demonstrated from the research, 40% of people in hospital have got dementia. 30% of them has got. If we do that recognition early, we can reduce pressure sore, falls, pneumonia, and complications of it. That means we reduce that, let's stay in the hospital. I'm talking as an economics hospital. For those people who are interested, kita cakap ni environment. We're so lucky lah. I mean, kita Elizabeth is the first hospital in Australia that GM unit is purpose-built untuk orang tua. Ada 2 garden, ada passport garden, ada banyak kena healing environment. So maksudnya ada volunteer mengajar budak sekolah menyanyi, main gitar, menyanyi, macam. What I meant to say, kita ni champion. Siapa dah cuba campaign juru rapat, the most important report tidak. Kena doktor boleh buat. Ni, tidak. Senang. Orang asli kita joinkan masuk sekali. David, ada website, tingkat, resources, kita click all the best resources in the world. Now, kita nak buat ni lah. Kalau contohnya saya minta tolong semua, dia buat Mindful of Dementia Day, Connecting the Dots Day untuk kawasan Klang. You suruh lah Dr. Amin ke sana semua ni, buat apa dengan matron semua ni, buat apa collaboration supaya jemput seluruh Selangor, showcase what you've done di Pandamaran kan, dekat Shah Alam, betul ya tak ni? Jemput orang NGO, jemput TopGlove, semua datang. So we normally share not just within South Australia, Canberra, and then I minta tolong lagi menjadi the most best hospital, the most best clinic in Malaysia. Buatlah the real dementia friendly community center ya dekat kawasan ni. Okay, terusnya ini dia. Quickly before we go to drugs. Carpeting important, environment important, choice of food is important, so that it makes the operation successful. Okay. Oh ni. Simpan. Medications are important. Remember, you can make the triangle atas atau bawah, tapi the particle cannot reverse. Okay? The particle akan terus menjalan. Kalau orang tu Alzheimer's disease 6.7 years hidup kehidupan 40 lebih lagi, kalau tuan benar. One thing to tell you is that this is the drugs, Alzheimer's dementia, ada drug namanya ni lah. So what I'm going to skip some contoh ni kan. Ubat ni, I'm going to ask, ada tak ubat ni dekat? Ada.
Oh, yeah, 3. For 19,
Okay. Faham. This drug yang I cakap tadi itu is licensed for the beginning, mild to moderate stage of dementia. Maksudnya nombor 4 to nombor 5 saja. If that patient needs one person to help them, the drug is not suitable anymore. Okay. So make sure your letters are set passport and passport, not less. Unfortunately, this is only, I think, applicable in some parts. Most of the private hospital system, including patients, or even promote when they are 3 to 4. Yes. What it means is, you have not ubat ni, ubah macam ni. I like ubat tablet. Resep, 5 milligram, 10 milligram. Ini ada 8, 16 cuma lah. Ini patch. The patch is designed because this drug, what it does, it actually promotes the brain chemical called acetylcholine. What does it mean? Brain cells, brain receptors communication. Kita lagi mantap, cepat lagi therapy ya. Tapi dia tak boleh buat kita punya memory better because you lost that part of your campus kan. Tak boleh kan? So contohnya, ini actually start yang mudah-mudah kan. So kalau kita nak buat benda ni, kita tidak tahap bagi orang pun. It's not going to make the memory better. It's licensed for this, but you must be very careful because this medication can only be used at a certain duration of the trajectory of the dementia, which is your past 5, yang cocok. Lepas tu, how to start the medication? Ini cara dia. I tanya orang kucing tak ni, dia kata, some of the patients are given this medicine. Contohnya lah, siapa nama cik? Nama doktor ni? I give you 60 cups of tea, boleh? Boleh? Bagaimana boleh? Maksudnya dibagi kapal laut, kopi pecah tu dalam di mana, tidur tak ada, kecil tak habis. Tak boleh. Tapi I tengok masalahnya, I review Australian Medicine Handbook every year. So I know this drug must be given in the morning sahaja. Betul tak? Kucing dari malam. Kenapa? Tidur tak boleh, nightmares, terror. Ubat ni only works in 1 in 4 people sahaja. This is the problem. The best outcome you can say, oh, I remain the same. They will never make the therapy better. But what it hopes, yeah. Yeah. But no, that means that patient has got more vascular dominance than Alzheimer's. So the type of dementia, so kalau ada PET atau PET analog lagi more. Kalau lagu talk about that ni lah, dia macam ni. Be very careful. Ubat ni macam bagi kopi, cap laut, cap kapal laut, tak tinggi. So anxiety tu alamak, saya tak senang, tak besar, duduk tak boleh makan, senang, tak rela, susah nak ada. Jadi ubat ni dia memberi hope, tapi it will not make the dementia back. What it does, dia tak yang triangle kan, the delaying the emergence of problems. What are they? It's a good one. Now, my professor in Birmingham led this research, membuktikan ubat ini yang kita main kita sanjung-sanjung ni tidak boleh membuat orang itu hidup lebih lama, tapi memberi kita hope. Apa hope? Memberi kita hope supaya kita minta orang itu lebih aman lagi, faham ya? So dia cubakan. Jadi saya minta tolonglah kalau orang kata just because you don't have this medication, it does not mean that it is one of the things now. For those who work, you can see it reduces the emergence of this problem. Triangle kan? Now, lepas Memantine, what is Memantine used for? Sorry. Memantine is actually licensed for this. When the fast scale, fast scale is 5 ke 6 saja. 3 to 5 years of dementia. Predominant Alzheimer's disease, these do not give to people with Parkinson's, dementia, people with support, tapi tak jalan juga. You bagi ni in the hope that you start one drug first 3 years, kalau boleh jalan, boleh ambil, continue. Lepas you berhenti, in UK you progress. In Australia privately you go. Tapi in Australia one drug funding setting. So kalau boleh, tapi make sure 1 in 4 itulah yang dapat benefit. Okay. So what you do, you suggest kata dia maintain ni, kata dia small yellow white tablet dibagi, dia bagi 10 milligram sekali or twice a day or 20 once a day. Is licensed for reduction of agitation and aggression. Faham tak? Faham? Ini penting ni. Nampak ni? Kalau ada nombor 5, nombor 4 buat, cuba. Tapi maybe working in 30% or less saja. That's how we give the drugs. Bukan setakat MMSC dah. Di Australia, you must demonstrate that the MMSC must show 10 to 14 days for funding. But most of our patients, the drugs are given is financial sendiri. $1 satu DVD segala boleh murah dah. Macam tu.
So last time mahal. Dan posisi wise kata you can start nanti you can beli so nanti
So the best medication that will help them is actually antidepressant at the beginning. Now, afterwards I will talk a lot. Yeah. Ini cara ni hari ni okey ni. Well, yeah. Okay. So this is quickly. Kalau you nak refer, minta slide dari ini pasal hospital punya policy macam nak katakan patient dekat community ke ubat ke. Antidepressant macam ni, ini nak kena. Ada tak farmasi yang ada? Ada farmasi dekat sini. Farmasi saya pakai tangan. Farmasi pakai tangan yang melayu. Okey. Contohnya lah, senyumnya, voice keluar ya. Ini, this is slide is important. Contohnya tengok, kalau banyak plus tu, masih kurang masalah. Okay? Masalah kan? Pernah tak tengok? Contohnya kan, SSRI, promotion of serotonin. Apakah serotonin chemical bagi happy? Exercise pun boleh jadi happy juga. Makan teh tarik jadi happy juga. Promotion of not this serotonin, but is promotion of serotonin, working on serotonin selective brain receptors. The other one is epinephrine or adrenaline, ya. Maksudnya more adrenaline lagi happy lah kita. Some ubat tu ada dua combination, affecting more serotonin dengan more epinephrine. Contohnya SNRI, dia dua-dua ni, dia memang bagus, dua-dua. Masalahnya lagi banyak kopi cap kapal laut. Ubat ni problem. Nampaknya ubat glamour, bikin ubat ni silap orang lagi anxious, lagi psychotic dia faham tak? Dah tahu kan? Lepas tu ada ubat yang bersih-bersih lah. Contohnya farmasi yang tadi kan, yang lalu kan? Algomelatine ataupun valdoxan. Ubat ni baru saja. Ni lepas 5 years. So in Australia only available by a private satu hari $2. Ubat ni tengok, kurang ni. Minus agitation, sikit je GI effect. Satu je insomnia, hypertension tak ada. Tengok, tak bagi kita mengantuk, tak bagi kita impotent, tak bagi apa tak? Betul tak? So kalau orang tu bekerja, pergi kerja bank ke, apa kita ubati? Tapi kalau yang paling bagus untuk vascular type dementia ataupun frontal temporal type dementia, you need to promote these two drugs down. Masalah besar. Dinesh, why do Dr. Faisal hate fluoxetine especially? Why do I hate it?
It takes time to work.
Right.
Not a side effects.
We go to side effects. Importantnya, ubat-ubatan ni ada baik dulu. I give you an example. Ubat paroxetine Aerofax. Paroxetine tengok. Kelas, semua banyak. Sebab dulu zaman-zaman 80s dekat Amerika, kan ada stock market crash kan. So dia punya apa tu, investors day crash kan. Ambil ubat ni, bergerak ambil. Lepas tu dah stock naik balik, berhenti, mampus. Kelopak, sekali, hati semua. Ubat ni is hard to shake. The problem is drugs. All the drugs that paroxetine is class, especially paroxetine, class 3. Class 3 anticholinergic. What does it mean? Let me refresh your memory balik. Apakah guna ubat ni, tuan-tuan dan puan-puan semua, membantu promosi kita punya acetylcholine, betul? Yang ubat ni pula terbalik tu, make you happy. Make you happy, but it drives your acetylcholine, antagonizing each other. So kalau ini bagi ubat patient, antidepressant ni, bagi dalam ringan, doesn't work. It's a waste of money. Betul tak? And then you stop suddenly have pains, withdrawal. Ubat ni power manufacturing. 2 chemicals, 2 receptors. For young people, okay. Kalau older person, dizziness lah, sakit perut lah, ya, risk of psychosis lah. Jaga ni. Maksudnya tengok plus agitation, you tengok. Tapi kalau orang tu very depressed kan, depressed, you have no choice kan. You kena resort, you know. Fluoxetine ni canggih ni. Ubat ni power. They help untuk nerve pain, neuropathic pain. I'm so sorry I speak a lot about medication because I promised Zainab I will talk about medication. No, mirtazapine, sertraline is my favorite antidepressant. Mirtazapine ni bagi malam, bagi appetite kuat, tidur bagus. Tapi make sure you look after the procedure, make sure you meditate appropriately. So, antidepressant is part of the life of the part of the processes of the 40 people with dementia. So please tell me, as part of the therapy that you did, you mustn't forget antidepressant. Yeah? Tolong Lepas tu, apakah BPNC? We don't use this term anymore. We use primary behaviors. Maksudnya ni tau. Apakah cara-cara, tapi sebelum cara-cara ni nak abang sikit. Dekat Australia, dekat England, and in Malaysia, I hope so, you boleh bagi nutritional supplement. Maybe kan, TopGlove boleh tolong. TopGlove kan, contohnya lah. This one kan, is supplement. Dalam botol tu, 120 ml. So ada at least 2.7 grams worth of omega 3, that means fish oil or omega 6, contohnya macam coconut oil yang non hydrogenated. Dalam tu ada vitamin B, termasuk info extract from milk. Ubat ni, ubat. This nutrition, no milk, no sugar, ya. So lactose intolerance friendly. Dia functional improvement is 60%. Meditation 20% kan tadi kan. It's at 90% and dia tinggal quick dah. Tapi at sana, berapa? Besar. Kalau beli di Australia, one bottle $3.30. Now we come to the powder form. Why don't we give hope to our community? Or whether you buy fish oil, they can say, they can get it. Whether you buy coconut oil, yang dah proses, bukan yang beli nak goreng darah. 5 tablespoon, as opposed to olive oil, you put in your salad kan sama. Betul lah. Tapi yang penting ni, don't forget about pain management, don't forget about bowel continence, and then make sure, alamak, please saya bowel time. Please lain. So how to do cognitive assessment? Apa lah? Please like, maksudnya, how your clinic, Dr. Amin, Dr. Zana, your patient must be willing to be treated. That's number one principle. Kalau tak FPA fails to attend, ya, datang sekali tu tak muncul sebab kurang awareness, kurang stigma reduction. Betul tak Dr. Zana ni rugi. Maksudnya kita kena make sure that as FMS we must mobilize all the workforce here, all the volunteers to make sure that kalau kata make sure datang jumpa Dr. Amin ni, insyaAllah Dr. Adil akan cakap ni, bagi souvenir, bagi fish oil, coconut oil, boleh exercise, boleh nyanyi, boleh origami, betul tak? Contoh boleh tak? And then must make sure lah kita we talk about hydrocarbon, we talk about so other things. So don't forget, it doesn't mean dekat Adelaide kan, jumpa makcik Miut 90 years old, rupanya tunggang Allah masih kan. So you don't forget, you must ask. Tak tahu, jangan assume ya. Make sure that ubat-ubat contohnya tramadol tu, apa tu paroxetine, you must make sure ubat tu cannot belong anymore in the brain. The more you give it, the more the drug. The tramadol is a safe drug for adults. Tapi tramadol tu class 3. Apa class 3? 3 points and 3 allergic drug tu 3 tahun orang tua-tua dia buat test memory fail by 47%. Betul? Banyak tak? Fail kan? Fail. So make sure that kita understand the concept of, when to refer to psychiatry services, mental health, community services, kan termasuk juga kalau contohnya lah macam understanding of cognitive. It's when Dr. Amin dengan Zana be able to modulate sesuai dengan budaya Malaysia. Betul kan? So every country is different. Understanding that, our brain is so powerful, knowing the severity, tahu lah. So saya dulu belajar kat England, tapi I did some training in Sydney. I know the importance of Buddhas, how to do talk from test. I thought my own clinic, I don't want it needs to be competing with the population in Adelaide, where 40% of Greek, Italian, Russian, Serbian and Croatian. Kita kena make sure it fits with the population. Ya, betul. Lepas tu kalau contohnya saya tanya lah, katanya question punya wife. Dia kata, husband I lupa wala makan, tak tahu apa kita tahu. I guarantee apa test kita buat pun, most likely the wife is correct. That person has dementia. Tak payah buat PET scan dah. So a good cognitive story, background, collateral is important. And then ini kata di sini nak check apa tu screening condition. Apakah clock test? Katalah Dr. Amin ada PET scan. Ada PET scan.
Siti apa PET scan?
Ada PET scan. Scan. Okay, TopGlove beli one SPEC scan untuk ini. Very important. Maksudnya, You take blood sample kan? Kalau aku check technique, you go to the brain, you ambil picture. Tapi dia akan ambil gambar as the brain is confused with the radio nucleotide. It will tell you campus 40% activity, 50% ke frontal. So I can actually map. Ini most likely Alzheimer sebab ada temporal deficit contohnya. Atau sparing of the cortical stimulus mungkin di body. PET scan glamour. Kalau tak ada, sangat-sangat akan pergi ke mana kat bawah Sarawak. Contohnya, ada pen tak? Ada paper. Okey, Dinesh. I want you to draw a clock face ya. Bulat, buku nombor dalam macam pen England ya. Doktor buat sekali di luar ni, tolong. The time is 1:45. You have a less than 30 seconds to your clock now. So I'm asking Dinesh dengan doktor tu, buat clock face, buat bulat kan? Dia dekat perak, dekat mana? Perak, ada clock tahu. Betul-betul, kelihatan. Betul? Betul. 12, 3, betul ini lah. Buatlah clock face cepat. 1.5. Dia yang sebab orang lah ni tak tahu dia digital, nombor, bulan pun nombor. So 1.5. Contohnya, ini clock sign. So Dinesh, very good. So 1.40. Bagus dah? 1.5. Bagus. Doktor pinjam. Alamak. Doktor pinjam. Second one, I sebagai examiner, Dr. Amin akan buat clock face akan di-copy oleh pesakit ya. Masa 1 minit. Ini outcome. The first one adalah contohnya dengan doktor kan. Nombor 1 dia buat sikit bagus. Nombor 2 kopi pun bagus. Nombor 3 kan kita buat MMFC kan ada macam mocha macam ni kan. Bagus. Nombor 2 ni, kalau orang tu pesakit Alzheimer disease, temporal frontal dah tak jalan dah, tak boleh mula. Ini dia ni cuba. Ni apa ni? Okay. Kopi pun tak boleh. Tak boleh dah. Okay, no. Lepas tu, ni macam ni. Tapi kalau vascular tak dementia yang second common is walk. Satu tak boleh. Second bagus. Tak payah buat PET scan. Tak payah nak minta tolong dekat TopGlove dia. Boleh buat ni kan. Maksudnya bos sakit. Vascular sakit. Ya. Tolong janganlah bagi orang Demensia kan. Kita berapun tak kan. So, I'm not saying this is how to do it all the time. Yang paling bagus kalau tolong TopGlove di Dr. Amin one spec machine senang kerja dia. Except kalau pendalaman saja. Tapi I will terbangkan mereka. Ya. Sebab kita ni kena ingat treatment is gold standard. Do you think someone with cancer dia akan tak payah pergi transfer PCT mana ada? Dia akan buat semua kan? Betul. What is cancer so special compared to dementia? One thing. It's the core business, your core business. You know what? That is your main job. 40%. Why? Cancer more important. You tak tahu. Maksudnya, saya taklah nak buat HIV testing ke apa. Tak ada. Bergantung. My youngest patient can be 24, 25. Kesian. Kesian, they are young people who's got maybe 6 or less years of living. I think it's worthwhile for me to fly them from different parts of Australia to come get a scan. Betul tak? So that the medication can be given at the most dignified possible. So Rudas ni is designed by my team, not me, led by Jeff Rowland in Sydney. This is the most compassionate and language bergender. Maksudnya, kita ni di Malaysia tengah tu sekolah maybe kurang lebih 6 tahun, mungkin lah. Yeah? Tapi kita kena cari tool yang tak bias gender language, faham tak? Dengan education. And mudah sih. Kalau you pergi Denmark, you pergi Sweden, apa nak ni? Kenapa Malaysia tanya macam negara ni? Benar lah, pening balai. Asal tak boleh. Maksudnya kita kena berubah mengikut negara maju betul ya. Senang nak buat. So apa pun I buat, kalau ada cure which we don't have, hijau. Semuanya akan terprogresif dan kita nak buat, nak delay the symptomology kan yang apa? Sebenarnya contohnya Dr. Amin interested. You can write to my friend, Rod, boleh tak start a program discounted this conference course from post to Malaysia to Dr. Amin untuk selected patient, charge lah price, nak mula boleh. Kita kena ada jalan malu, okay lah? So, the most important thing that I do in my clinic is to check mental capacity assessment after I diagnose them. That is my job. To make sure my patient can make their own choices, able to sign legal documents, able to go to the bank and sign the contract, able to assign their family to become their voice. This is my job as a graduate. Yeah? So sometimes we can even talk this if we haven't talked about the first bit. Betul tak? So, alamak, orang gila empat ni. Cuba, slow. Okay. If I do my letters, ini contoh surat national, surat dementia. Ini different to dementia Australia ni, Dr. Amin. Ini kawalan pandai, negara pandai, tapi untuk orang-orang yang ada change behavior. Betul tak? Orang yang kat rumah betul-betul, orang yang luar ada masalah. Dia masalah sebab due to dementia, dia boleh wandering, agitation, ke psychosis, ke dia tak dangerous. So we will fly squad, one more thing, kita terbangkan daripada sini, pergi ke Belukin, pergi ke Perak, pergi ke Teluk Kuantan, ke mana lah, pergi ke Pulau Angkot Perak, silap. Pergi, dia akan, then dia write for me, kata Faisal, these are usually nurse specialist, nurse OT specialist, ataupun pembantu pada ya. Dia akan balik, telefon saya akan kata, okay, this other my letter should normally be like this. Penyakit ni, type ni, ini dia punya ni, ini symptom dia, ini triangle dia, ubah-ubah ni. Firstly, address pain first. Yeah. Number 2, address anxiety and depression. Betul? Sorry nanti minta salah tadi. Lepas tu, address the antipsychotic. Lepas tu, kita dah tahu lah, apakah change behavior. It could be hallucination, it could be wandering, it could be physical agitation, depression. All the medications are called behaviors of concern. Yeah, we do no longer use the word violent patient. Maaf ya, itu bahasa yang biadab. Betul ya? So these are the problems that you might encounter if you see people or support people in hospitals, community kan. This might be your own family member. Betul tak? So ini, my team punya manager buat research dekat South Australia. What is number 1? Number 1 means dekat Adelaide masa tu ni. Adelaide in severe. Contohnya, patient dari rumah, masuk hospital. Patient dari rumah, masuk rumah hospital tu. Then patient ni kita nak mandikan, dia tak nak. The next one is happening is physical. That means dia physical, dia tolak, betul. So, ini adalah comparative to MPI stats study Australia. So what I'm trying to say is that every case is different. Bergantung pada so, ubat ni ulang balik kita bincang kan. Betul? Contohnya dalam my attachment, sorry kat Zana, dalam slide tu, Dr. Amin ada biological intervention. Maksudnya 20 tahun research pasal ubat-ubatan di dunia. Kami dah kolekkan to make sure that persembahkan cara terbaik. Gunakan contoh ubat ni, galantamine. Betul kan kami? Apa yang bagus banyak ada bagus. Galantamine dengan donepezil. Strong RCT lah. Kalau dos yang buat research paling bagus di dunia ni kita tengok. Kenapa kita promote donepezil untuk empathy, untuk ni? Betul tak? So kita kerja ni must be evidence based. Bukan dekat mengaku je, betul? Mesti cara-cara yang paling bagus using ataupun umbrella by research, and training. So contohnya ini kalau saya doktor specialist, my letter to the FMS macam ni upaya, betul? Kata tolong, lepas tu tolong GP naikkan ubat, tolong buat ni, macam ni sebab saya untuk one paragraph. Macam ni saya ajar supaya GP FMS jadi super duper FMS pharmacy dan dinas. Kita ajar sampai tahu macam nak buat. Betul? Lepas tu kita emphasize more about medication bila nak aku. Some people kan dia tak boleh ambil ubat sebab dia jantung ke, ulcer ke. So we must be quite clear lah buat ECG. So nak lompat ni. Dia bilang kan Louis body dementia ni pelik sikit ni. Depan the top 5 dementia. Masalah besar ni. Diorang ni lifespan 3.3 years. So they have problems, mimic Parkinson's, not quite disease. The problem ni, dia nampak di Lilliput, orang tengok, orang kecil, nampak macam kecil lah orang nampak apa, orang kecil ke, kucing ke, anjing ke, hantu, kecil lah. Tapi yang sepelik ni, kalau my patients from Cambodia and Vietnam, dia nampak fox, maniac, pelik. Maybe that's why they're exposed to PTSD, ikut rasa. And then diorang punya ni, bagus, petang ni okay, besok tak okay, memory change so quickly. The next thing is that, diorang punya ability, prison memory. Your body not better from a short recall. So that's why it's quite confusing. So why PET scan is important? It will help you to distinguish between those nuances and cases. That's the reason why you need to make sure that now, indicative, boleh buat KDM, macam-macam boleh buat lah. So these are what we call the goals, these are the pillars of diagnosis for Lewy body dementia. This was done by John O'Brien, Professor of Psychiatry of Monash University. So the thing that kita tahu, people with Lewy body dementia, kalau bagi antipsychotic, yung boleh tidur half a day. If you risperidone, kalau sila buat typing, dia boleh half day tidur. Macam sebelum beauty, boleh tak? Sebab dia ubat is sensitive to antipsychotic. And then there are all of this. Imagine that if somebody has got problems like this type of dementia, Masya Allah, 3 years. Okay, kita sebagai jururawat, sebagai putih, pharmacist, doktor, kena faham, membantu, kan? Membantu ni kalau boleh cara yang bagus, education and education. Now, what are change behaviors? So, ini, understanding your triangle, very important, knowing when to start, and then knowing that the good and the bad. What is the good? It helps you reduce the triangle balance. Problem with the physical, hopefully becomes something milder. Yeah? And then you understand that the effects could be many. For example, commonly we've seen about the changes in posturality. Banyaklah all those things mentioned already. And then kalau patient given too much antipsychotic, sometimes they have Parkinson's effects due to many drugs. So what I'm going to do, I'm going to make sure that you understand these drugs, antipsychotic, benzodiazepines are chemical state. Apakah chemical state? When we say that means human rights. So you must get consent from caregiver ataupun possibly the person itself. Tapi minta maaf ya, kami nak cuba ubat ni. Mungkin cek body brain ke, mengantuk ke, jatuh. Jadi kami nak educate. Normally it's done by a pharmacist and the doctor or the clinician, weirdness, OT. So all must understand the concept. And also kena faham lah. Ini penting ni. Yang paling penting untuk our pharmacy and orang kat sini kan. Research done in 1999 ya, 3 years dah. They check, apakah antipsychotic? Apakah antipsychotic? Antipsychotic neuroleptics, medication that can modify your behavior. Contohnya, saya bagi one tablet to doktor tadi, dia boleh mengantuk, boleh tidur kan? That's how powerful the drug is. But the drug has got problems. So the drug is looking at odds ratio untuk stroke. Kalau comparative, guna risperidone tak? Risperidone, 1. That means it's a good drug, it's EBS, that means it's encouraged by the government of Australia. But masalah itu, risperidone ni is not the only drug, there are many other drugs. So kalau orang tu ada Parkinson, dementia, Lewy body, the only antipsychotic in is this one. Dia punya graph ni, yang paling betul dia bagus. Okay? But if you want your patient to have strokes, you give them the green one, vitamin H. Okay, tak nak kan? Nak kill patient faster, you give them too much benzodiazepine. Betul tak? Maksudnya masalah ni, ubat ni bukan setakat boleh di farmasi, beli tak boleh. Guna ada expert, pharmacist, doktor, nurses, MA yang advice. All of them must undergo training. Betul tak doktor? Jangan setakat Google tak boleh. Lepas tu, kita kena understand the concept of what does what. So the same article yang tadi yang kan dia bagi tahu risperidone not with this. Quetiapine, saya suka. Why do I like quetiapine, Dinesh? Why do I love it? Not love it. Why do I like it so much? Why do I like quetiapine? Number one, I said love salah kan? It's the less odds ratio for stroke. typing ni, Dr. Zana, dia macam ni. Dia color dia macam ni. Kecil sangat. Kalau orang tu ada dentures satu, potong paut, potong quarter, jadi paut dia lekat kat dentures. Jadi tak efektif. Jadi kena faham ubat ni, cara besar. Jadi ubat ni ada yang besar, kecil. Typing ni yang bagus ni, dia selamat, dia mengurangkan stroke risk. Number 2 ni saya suka sangat ni, sebab dia pun bagus untuk bipolar, schizophrenia. Tapi importantly, it will work on your dopamine receptor, makes you happier. Betul? Bagus. Tapi ada masalah dia bagi postur drop pada. Yang biasa ni risperidol. Saya takut sangat bawa tunjuk slide ni sebab kan nak encourage orang guna drug pula. Kan? I'm telling you, last week ada summary kan. Start low, go slow. Kalau orang tu meditation dan yang triangle besar kan. Kalau triangle, you start small, you minta permission, you bagi tahu. You habak mereka, ubat ni be careful. Can make you drowsy, sedated, and then extrovert. Lepas tu you talk about other options. Macam contohnya olanzapine. Olanzapine ni pun bagus juga. Because it comes in injection form. Yeah? It also comes in vapor form. Yeah? So nak start macam ni. Contohnya, orang, give example lah. Today. Give example lah. Okay. Hari ni, masuk hospital. Under Kak Ros jaga. Patient ni ada Alzheimer, spatial 6. That means nak pergi bilik ayah dan orang teman. Patient ni marah sangat. Dia macam marah pula Kak Ros. Tapi sebab dia tak nak hospital, dia marah. Tapi kita kena membantu dia. Jadi ubat tu dia pilih banyak ubat. Make sure dia tak rakit, tak ada pain ke, tak konsep check ni semua, tak ada infection kan. Lepas itu bincang dengan Dr. Amin ke sana, okey, kita nak turunkan triangle, boleh tak sikit bagi kuang hangat sikit. Dia choose ubat ni suka sebab available. Smallest dose is 0.25 mg. You normally start once a day, twice a day. You habak your family. Kalau dia tak nak, you balik pula. Kita boleh. Sama lah juga. Kata typing ni, same juga ada ni. Tapi observe. Jangan tunggu melampau naik. Tengok dulu. You buat behavior chart. You get those. Because of medication, the triangle after 1 hour, buang sikit. Lepas ni boleh incremental slowly and gradually. Dan katalah crisis ni, tak mau ambil ubat dia straight away. Ini datang in injection tu dah, olanzapine. So kalau adult psychiatry, olanzapine is preferred because it comes in intramuscular injection. Kalau pedal ni, kalau ICU, kalau dekat England ni, dekat Sweden, kalau brain surgery, heart surgery suka bagi ni. Sebab comes in injection. Tapi not for a long time, betul? Injection is used for crisis. Ubat ni so powerful, you give untuk orang tu lah. Tengok, yang paling banyak dia stroke ni. Betul tak? Ni kan, ada pedal hijau tak? Betul? So be careful. So ubat ni long life. Injection, 20 hours je. Not nice kan? So these are the purpose of this drug antipsychotic. This is the summary. How to start the drug. Pelan-pelan. Jangan ingat, don't memorize. Make sure you go to Dr. Amir, Dr. Zana. Tolong ya. So benzodiazepines, apakah itu? Pernah tak dengar Valium? Diazepam. Oxazepam ni yang paling mudah. Oxazepam ni dia bersih. Dia macam buat tidur kan. Kita ambil power tu 4 mg, ambil. Dalam masa sekali tidur lah. Hospital. Temazepam dah. Saya jumpa dalam berbahaya tu. Sedih saya. Not your fault, not my fault situation. So the drugs, clinical therapeutic drug, tolerance. Ubat ni ada sebab tempat. Kalau bagi oxazepam, dia ni safe, deliver safe. Dia last tau. Sometimes it works within 30 minutes tau. Usually last about 4 to 6 hours. Itu cepat. But tidak bagi boom, tidak benam, okay. You bagi diazepam ni, diazepam ni tak lama sikit. Besok dah pergi bila tak betul dah. Lepas tu, kalau untuk orang yang teruk sangat, ekstrim ni dia macam tidur, tak nak gerak, tak nak, sebab dia rasa besar, dia rasa macam resah sebab dia dementia. You give them Nonatipa. Bagi yang drop tu tidur macam baby, tapi besok groggy. So end of life, people severe dementia, end of life, my preference after oxazepam is Razepam. So Razepam is untuk strong adults. Yeah, that means you give them 0.5 milligram or twice a day plus day, and you will help. Ubat ni untuk reduce anxiety, betul tak? Ataupun PCS. Ubat ni kalau nak bunuh patient cepat, dia bagilah benzodiazepine. So that's why I can say that. So I'm here how to start oxazepam. Kita dah faham pasal antidepressant tadi kan? Anxiety. Nak cerita ni, anxiety ni common. Anxiety yang bagusnya, the more I talk to Dinesh, that anxious he become. Dah kena jadi cinta betul. So imagine, apathy ni masalah. Kalau anxiety is not addressed, you do not need antidepressant. Katakan someone has got vascular dementia, frontal lobe sudah dekat at the beginning. Kita tak tahu bagi apa kan. Kan? Lagi lama-lama tak nak bangkit pagi, tak nak keluar, tak nak olahraga, problem. Okay? Padahal you boleh promote dia punya brain chemical, dan promote dia punya apa tu, serotonin, penyakit betul tak? Ubat. But tak apathetic. Depression as the effect of that. From severe apathy, you become depressed. And that's not a nice feeling, especially for the caregivers. Apakah ini? Ini kalau dekat IPA ini memang masalah besar ni. Maksudnya, sebab dementia, Alzheimer ke, tidak mudah lah. Diorang tak ada lost the filter. Contohnya, dia menunjukkan barang kipas private kipas orang lain. Yang kita berbahaya ke? Tak boleh. Tapi yang peliknya, ubat ni, contohnya, might be able to lah. Ubat antidepressant, pun dia boleh turun. Tapi, not as effective. Yang baik, tapi it's the thing about, you have to really understand. Kalau buat kat rumah sendiri, maybe tak call, pun tak nampak. Kan? If you do it in public, it's not right. Betul tak? Tak boleh. So, antidepressant ni, ada yang bagus, tak bagus, kita faham lah. Ini anak one by one. How to start. I won't bore you all. Ni rupa dia. Ni my favorite antidepressant ni. Dr. Zana, Dr. Ami suka. The safest antidepressant untuk older people is this one. Okay. Be careful. Sodium start macam tu. Naik maksimum 200. Color dia warna-warni. Boleh? The next one is all drug. The best maintenance untuk dementia over 30 mg. Okay. Lepas tu, ini yang the newer version lah, so starting fine. So, Vitazepin is my second favorite. Untuk orang yang nak tidur, orang nak bagi appetite pun bagus. But it start like this, you can implement maximum untuk older people maybe 30 or 45. Jangan jarang I bagi 25, ya. Lepas tu, untuk depression dengan nerve pain tak bagi ni. Dan diabetik contoh sakit kaki tak bagi ni, ya. Lepas tu contohnya kalau orang tu memang depresi lah, diabetik, I rasa I nak really reverse. Bagi medication yang work on two receptor. Betul? Receptor apa? Serotonin dengan epinephrine. Lepas tu orang yang paling glamour ni, kalau contohnya ada orang yang masih bekerja, working, you're concerned about side effect, you give them valdoxan, ya, 25. This is sorry lah, I mean, how to convert from one drug to one drug. Ini masalah besar. Pharmacy yang bertanggung jawab. Kalau in the future minta government, state government ataupun TopGlove, you beli software. Nama software itu macam ni. Western Care Drug Burden Report Software. Maksudnya, ubat-ubat ni, kalau silap bagi ubat, dua ubat is good. Contohnya, ubat ayam, Fruzmat, water tablet tu kan? Dia 1 point. Beta blocker, adrenal 1 point. Betul? Kalau 3 point tu, 1 to 2, after 3 years, fail screening condition by 4.7%. So, in nursing home, in Australia, the pharmacist uses software system, they tengok patient nursing home 1 to 2, automatic kira. Patient A, 13 point. It's not nombor ni. 3. How? So, they must change it. Contohnya ubat untuk incontinence kan atau hospital. So I'm going to tell you this, it's so important that our pharmacy become strong force in your team ya. Sebab ubat tu boleh membinasakan. Cara-cara nak membantu kesakitan sangat penting. My job as a specialist dietitian, you must be also an expert. You must be able to promote medication like a weekly patch. Contohnya, buprenorphine patch. Contohnya, patch. You must understand the concept of tapentadol, capanol. You must know that. That's why. Because ketika orang tua ni, it's not just about syndromes untuk geriatric macam pause ke, muscle wasting ke, tapi jalan ke. Pain pun very common, right? So we must be able to do this and then to work closely with our pharmacists and like them to get the best outcome. What I meant to tell you is this, kalau kita ni tak jadi tua, kita nanti mati ke tak? If you're not getting older, you are dead. Betul? That applies to everybody. Kadang-kadang kalau sekarang ni, our mind is like turbulent kan, macam ayam, macam air kan, susah nak lihat. Tapi bila dah calm, dah feel, dia balik office, dah tenang, kan jelas sejelas-jelasnya. Apa yang paling penting sekali ialah diri dia. What would you like to do? For you, maybe you wanted to change one thing, okay? How you communicate better with someone. Even now you know they've got tunnel vision. Now you know that there are things that can do this from changing environment. If I want to be the designer for this room, I kata, wait, kalau macam ni dengan line saya makan tidur kan? Call it the white noise. This is the white noise. Tidur, okay? Kalau orang tu kat Hong Kong, membesar kat Bangkok, pasang night market, tidur malam-malam. Begitu kan? Kalau orang tu membesar di Outbush dekat Australia, pasang tidur malam. Okay? So there are many things you can do in the hospital, in the ward, in clinic. Make sure that your environment is successful. Betul tak? Yang paling susah ni, ada seorang saja Dr. Amin, ada seorang dia Dr. Zana, ada seorang dia Datuk, ada seorang dia Dr. Susah, ada seorang dia Milton. Macam mana? Kita kena work together terus. Tak kisahlah bahagian hospital, community, NGO, bahagian problem, mana-mana tadi kita kena melakukan. Saya datang ni sebab lagu Fauzan Latif, Fauzan Latif, ada lagu ni tau. Nama lagu ni dari kaki tangga ke menara. What it means, you know, when we are nothing, when you were at the beginning of your schooling, you were at the foot of the tangga, faham? Dari kaki, now dah menara ada ke atas bukit, dia dekat atas. Dekat atas hospital ternama. Jangan lupa orang yang membantu anda. Mak, bapak, family, sudah betul tak? Saya kena ingat untuk diri saya. Datang ni kena nak bekerja membantu orang-orang Malaysia. Sebab lagu Fajar nanti cari kaki tangga ke penjara. Terima kasih. Ada soalan tak? Soalan? 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 Betul tak? Oh, boleh. 2 minutes. Soalan?
Kita motor kita pun 1 tahun. So dia si orang tu Demensia. Takkan dia tak ada apa-apa medication.
So it's not in academic, it's dekat kawasan pendalaman. So like this, when I said setahun, maksudnya to see me, but the treatment would have started as soon as the patient jumpa GP NHMS dekat klinik kawasan pendalaman. Contohnya, dia cerita lah banyak. Doktor tu dah tahu patient ni fast 4. Dia bersedia tak. Student dah mudah. OT referral, physio referral, dapat assessment untuk membantu dalam rumah. That's that. The GP would call me or email me, Faisal, kalau ada komplikasi. Kata Faisal, I'm a bit concerned. Patient ni ada banyak heart problem. So I would say, in that case, do not give your diagnosis or change to the mental trials. So what we do, seeing me kadang-kadang, let's say 1 year tu, kadang 8 bulan, treatment must start already. Because nak pergi tempat tu, I seorang. Kadang-kadang bawa registrar, macam bawa Emas ini, bawa SDR, tapi what I meant to say, they cannot wait 1 year to see. The FMS doctor runs the show in kawasan regional, run the show. There's no such thing as director looks after. No. My program, Dementia Australia NGO, who runs the show, nurses run the show. Nurses level-level boleh mengajak FMS doktor ini time nak bagi, kalau pedal dalam pam nak bagi oksikodor, memang canggih education tu. So there's no such thing as doctors do everything. Everybody has got a role. Masalahnya kita kat sini, probably said, they are people of purpose at the time. Problems.
That's about to change.
Yes.
Because kita dekat sini memang jadi satu dapat.
Yeah. So I understand. Yeah.
Share pengalaman dekat Malaysia lah. Sebagai how those
Yeah.
They also have this issue like waiting time like 8 months to 1 year to see them.
Yeah.
So what the patient is, because waiting too long, so they ask to see me in Klang, they ask to see me in something like that. That's what happened now. So when I actually they see me first, and then I write something, and then they decide because already given date to the end. Yeah. So I guess the way you expectation is like that.
Yeah. Exactly. Kita kena ada proses triaging. What is triaging? Contohnya, patient older person compared to young people or rapidly progressive cognitive damage. Those are different categories. Kalau orang tu macam muda, dia cepat perubahan mas, the waiting list is 3 months or 3 months. Mas. Orang tua, kita FMX doktor jaga very well. Complication susah sikit. I mean, lain tu, I can tell you, kalau bukan semua, boleh, tak susah. But I can sit with you, I will spend 3 hours, you can do it already. Masalah tu, is kalau ada change behavior macam psychosis lah, masalah jantung, kita macam itu maybe benar communicate dengan people pada ahli. Kalau tak boleh, pharmacist dengan bersuara besar yang harimau Malaysia faham kan ni? Tak boleh. Saya marah, kurang saya marah dari situasi. Kalau nak berjaya, tak boleh. Dan saya marah ni bukannya I'm angry because we are happy to go to work, come back and that's it. You must be able to go to work. You must be able to make the change, to change the mind, to help the people to live better and longer. That's your job. Otherwise, do not do this job. You're wasting other people who want to be in your shoe. You faham tak? I get angry lah tu sebab people they don't realize how lucky you are. Lucky sangat-sangat ni. So that means your student, they go home, they say, I want to become the pharmacist expert in periodic medicine dementia to work under future professor. Faham? Guru rawat ni kena ajak supaya yang paling muda ni become better dan mereka faham. MA ni boleh jadi PhD lagi tau, specialize in dementia. But this is dementia tsunami, pandemic dementia. Number 1 cause of death in Malaysia will be dementia. Number 2 is heart disease. Number 3 stroke and the 4th cancer. Betul ya ni? Lepas tu you must be able to have a platform, Facebook ke, benda to be able to connect better together. Contohnya, tiba-tiba Facebook ni contohnya connecting the dots. Ada masuk Dr. Amin Rana ke Datuk ke ni, kata ini I tengok patient ni umur 30 ke, kesian. I'm certain TopGlove I can find someone yang bertemu ni. Why do you open your own clinic? You minta apa tu? Warga Emasnya organisasi Usiamas ni memang boleh. Dia punya volunteer memang bagus-bagus. Ini England, I tell you what we did. Ada villa apa dah tu? Villa. Masuk villa, parking free. Villa. Masuk villa, villa baru sekolah tak? Orang pakai roti. Volunteer, mereka akan sit down. Dalam villa ada bilik. Bilik itu volunteer. Itu volunteer. Kita jumpa nurse practitioner. Nurse yang boleh buat screening program. QOT. Dia buat pump assessment. Guna physio pula. Lepas tu makan roti dengan jam dapur. Lepas tu jumpa one room, jumpa doktor, kami. Lepas tu ada clinical psychologist. Kemudian tu NGO, Dementia Australia, Dementia UK, lepas tu connect. Dapat orang datang rumah, the pharmacist boleh tolong bagi website factor. That's how your vision should have a center di kawasan Klang ke Pertamaran ke kawasan mana ke. Memang ada bila boleh jauh, boleh bawa buat ikram tak. Dan Klang, dia orang yang saya seterusnya ni, kenapa lah? Dan saya minta tolong ni, tolonglah sama-sama kita, tolong Dr. Ani, Dr. Zana, tolong Dato', tolong kita punya matron, tolong semua ahli kita ni, supaya mereka datang kerja happy sangat-sangat. Saya ada my job, macam hobi, tak hobi. Seronok sangat. I feel like my job is hobi. It's not difficult. Yang saya sedih ni, datang Malaysia, you are blessed with the macam-macam dengan Australia, dengan hutan, dengan bidang, dengan orang majmuk negara, budaya, bangsa, Islam, kan? Tapi when it comes to dementia, belum united lagi, betul ya? Next question.
I don't know, I think it's a very good point that I covered on personalized medicine and collaborative physician. I just want to know, like, as you mentioned, everyone here is working very in silo, they're not working together, but in terms of communication channel, even to make a very a collaborative decision, is there intervention that you have suggesting? Because access to healthcare, especially in the rural area, is very challenging. How did you suggest in terms of
Very good. So we write a long letter to TopGlove. Malaysia. We want to start an independent, non-governmental body that will become the voice and connection. You can do this, but not through the government power. They are the one with the point of referrals. They are the one that will become the big body expert. Contohnya, if you have that, they are the one that will be able to navigate through the different phases of dementia. They are the one that can refer the patient, and you visit them at home today. They are the one that you can actually communicate through, katakan between centers, university and Monash kan. Dengan contoh university, hospital, Dr. Abi, you can communicate with that channel. Because with NGO, there's like bureaucracy, that's things. Dengan NGO, you will work closely with Dato' punya guru, dengan you can expert into the happens. That is the formula of success. Kalau tak boleh nak tulis ke Dr. Amin, nak tulis ke ATM, dan izin dengan Dr. Amin, susah. Betul. I kata tak kucing pun, dekat masyarakat Malaysia, yang susah. Dia orang nak panik. Siapa nak bayar lunch nasi ayam? Saya kata saya tak makan breakfast and lunch. Dia panik ni, it's not kata until free, tak bayar apa. Tapi dia orang risau siapa nak bayar lunch. Dia tulis surat, lebih 6-15 surat nak bayar lunch. Untuk bagi orang makan. That is so difficult. Dengan NGO, TopGlove free, dia bawa. What I'm trying to tell you is this. I'm trying to tell you, we must be innovative. Okay? That's an answer. Any last question? Kita punya apa tadi? Saya nak minta satu je tanya. Apa ni yang pakai beda? Tadi apa?
Okay, saya OT, saya kerja penamaran.
Saya.
Okay, boleh tak doktor sharekan pengalaman doktor sama OT?
Oh my gosh. OT ni super power. Contohnya, Dr. Zana kan, pergi dekat Adelaide, saya bawa dia di Australia dengan program. Dia OT namanya apa? OT dolar kan. So bawa Zana dengan Dr. Natu pergi tempat orang disability equipment, semua-semua tu. OT ni sangat penting, sangat penting. Nombor satu, about safety check. Kalau kat hospital, Dr. Amin, OT ni dia akan tolong cognitive screening. Betul? Betul? Termasuk muka, benda yang lepas tu ada 20 point checklist. Macam boleh tak makcik ni buat ayak dia tarik kat rumah? Boleh tak pasang oven? Betul? Communicate. Lepas tu lepas tu nak kira sensi deficit. Boleh lihat ke, boleh mandi, dia akan check safe. Lepas tu OT tu akan hand over kepada OT community. What is OT community? From the agency yang menyebarkan, yang memberi layanan ataupun servis kepada OT person. In Australia, we call it aged care provider. Indonesia ni macam breast able ke handicap. Sana the biggest industry is after hospitality is aged care. Menjaga orang tua duduk di rumah. Dibayar tanggung oleh kerajaan negeri dan negara. Ha? Maksudnya kan, katakan dia kan tidak bisa orang. Orang tu dah diagnose kata frailty ke benda lah dementia. Jadi you akan communicate dengan Datuk Rohani dan team akan boleh tak come once in a morning to make sure pakcik ni ambil ubat dengan selamat setelah pharmacy check. Ataupun boleh tak Datuk Rohani suruh dia team tolong mandikan makcik ni thrice a week. Boleh tak tolong bawa dia jalan-jalan keluar, pergi shopping, beli makanan. Boleh tak buat sesuatu shopping dekat Tesco, dapat, betul? Lepas tu buka pula rumah orang tua yang bermaruah, yang bermartabat. Maksudnya OT tu boleh design. Bilik ni, ini memang terlingkup fail. Ni kalau memang terlingkup fail. Terlingkup, boleh terlingkup. Maksudnya OT ni make sure tu dia suasana rumah tu selamat. Clutter kurang jadi habis. Fail, boleh ni? Tak boleh. Maksudnya the environment must be conducive, must be safe. But also what is your responsibility? To teach that family, that carer how to walk. Ada tak masa jalan dengan dia? Ada? Ada, mulakan. Dia tu. Macam mana nak tu, macam mana nak mandi, nak pakai baju, nak hidup. OT juga akan membantu mengurangkan pressure sore. OT juga akan membantu make sure that equipment tu kat bahu tertukar ke. Jadi kita masuk different level, tak payah tak masuk kita shower dengan kursi ke, semua nak toileting. OT juga akan membantu termasuk dengan nurse towards the end nak ke arah kematian, membantu supaya cara-cara kematian nak meninggal tu memang seaman mungkin. Faham tak? Banyak kerja. Okay. Dia akan maksudnya banyak macam my advice to me is this. I feel kalau kita ada happiness is power maybe. Kalau jumpa patient kan, my patient kata doktor kenapa happy sangat. Betul. Your patient, your pesakit, you punya customer must remember you as a happiness. Nurse yang happy, yang positif. Kalau is day yang dia tak tahu macam mana ke. Dia happy dengan positif. And that is important. You punya persona to make your patient must be important. That's what I urge for these schools, the young. Your voice must be loud, must be clear. Faham? Pakai baju yang ada merah-merah, kuning-kuning, dan sikit. Okay. Any more people